ERCP. So what's the long word for that?
So it's endoscopic with a scope. There's no cuts on the outside. Retrograde, going back towards the liver or into the pancreas duct, and then cholangio, which is the medical term for bile duct, or pancreatography, which is the medical term for the pancreas.
For viewing the pancreas. So ERCP, that's pretty easy for me to remember. The other word's too big. So ERCP, do you do an ERCP on patients?
Yes.
What's it like?
So they are completely asleep for the procedure and they don't feel anything during the procedure.
Certain position?
They are usually placed on their stomach for this procedure. And after they are asleep, we put an endoscope down through their mouth and go down into the small intestine, and then we try to gain access to the bile duct or the pancreas duct.
So you go down there and try and get access to are you looking for the access with x-ray, or do you have fiber optics?
There are good tools, or we have some clues where anatomy will kind of put you in the way where you need to go. But then we oftentimes we always use x-rays as well to help guide where we are going with these devices.
So when you're in there with an ERCP, what do you do?
So when we're there, we have little tiny devices that almost look like a coffee stirrer, and those are called catheters. And we will go up into the duct, and with an x-ray machine, we'll put dye
What
in
duct
there.
are you going into?
So we can go into either one while we are there.
By either one, you mean the pancreatic duct or the
Bile duct.
Okay, so if we're looking for cancer of the pancreas, you go into either one?
Most of the time we're going into the bile duct because we're trying to resolve that obstruction from the liver that the cancer is causing. So usually you're focusing more on the bile duct there, and you're trying to establish drainage there and also make a tissue diagnosis if possible.
Now I know the answer to this, but it's a pretty tricky procedure, isn't it?
It sure can be.
And it takes somebody that's had a lot of extra training. And so we really appreciate you who have had a lot of training come to the Dr. Bob Show to tell us what it's like. So you go with a little catheter up into the bile duct. How does that make a diagnosis?
So you'll first do is you put dye in the bile duct, and then you're actually able to see if there is a narrowing or it looks like something is pressing on that duct.
And you can see that with the x-ray
Yes.
at that time. Can you see something pressing when you're looking through the catheter?
Well, you'll just get the impression that something is actually occurring in that area.
Okay. So we still haven't gotten a biopsy. We can see strictures. How do we get tissue?
So when you see that narrowing right there, we can put a little brush, which is a wire-tipped brush, and actually scrape the inside of that bile duct and get some cells from that.
What kind of bristles are on the brush?
There are little brushes or little metal wires on there that can help scrape some tissue from
So you
that.
scrape it up and down, you don't twist it around to try and get some tissue.
Yes.
And when you bring out the brush, you send that to pathology and they look under the microscope?
Yes.
And they're looking for abnormal cells.
Yes.
Tell me, what other things can you use ERCP for?
So ERCP can be used to treat disease processes in the bile duct, the liver drainage tube, or in the pancreas duct. Most commonly, what it is used for are people that have gallstones that are sitting in the gallbladder, and they roll out of the gallbladder and into the bile duct, which is the main channel that's draining the liver, and then they get stuck there.
So when they get stuck there, it blocks the bile juices, the stool turns white, you have digestive problems, pain?
Oftentimes, yes, very bad pain.
Bad pain. And so you can do the ERCP, this endoscopic, no surgery, going up there looking. How do you take the stone out?
So there's multiple different ways to do it, but typically you have to make a small little incision where the bile duct empties, and then you're able to either squeegee it out, almost like you're pulling a squeegee through that duct with a balloon, or you actually can crush the stone and then pull out the fragments thereafter.